Joining Oak Street Health means joining a team with a shared purpose. From day one, you'll be part of a care team that collaborates, supports one another, and cares about making a difference in the lives of older adults. As part of CVS Health, you'll also have access to a variety of opportunities to learn, grow, and build your career. And here, care doesn't just come from one person. It comes from a team. Everyone works together with one patient at the center of it all. Our providers are a key part of our mission. Here, they have smaller patient panels than average, giving them time to slow down, listen closely, and understand what matters most to each person.
I came to Oak Street Health to practice medicine the way I think it should be: personal, focused, serving the people who need it the most. Many of my patients are managing complex conditions, and some haven't seen a doctor in years. Without us, their health would likely get worse. I also value being part of a team because when I want to talk through a case or get another opinion, well, I can just turn to another provider in the clinic or consult with the specialist virtually. That kind of collaboration makes real difference in patients' lives. Being part of a team that puts patients first is what makes the work meaningful.
Our nurses and medical assistants help keep each patient's care on track.
Every morning, our team meets to talk about the patients we'll see that day. We all get to know our patients personally, so we're able to talk through what we see at each visit and bring different perspectives to their care. This kind of teamwork helps me to continue learning and growing in my role and helps us give each person the best care possible.
Here, we care for patients' mental and physical health, and our behavioral health specialists help us see the full picture.
When patients feel safe and respected, they open up. We walk through what they're facing, whether it's stress, grief, joy, and connect them with additional care when it's needed. Because I work closely with the rest of the care team, I get to see more of what's going on in their lives, not just what's set in a single visit.
Social workers help make sure nothing gets in the way of the care our patients need.
Sometimes challenges in a patient's life, like housing or food insecurities, can make it harder for them to get care. Well, we work on addressing those barriers so that patients can focus on being healthy. And when you see that impact, it's powerful.
Scribes support providers by managing documentation during visits, so the focus stays on the patient, not the computer.
I take notes during visits so the provider can give each patient their full attention without distractions. It makes the visit more personal and helps the whole team stay focused on the patient's needs.
Our patient relations managers help patients navigate insurance, billing, and other details so they feel supported and confident in their care.
Medicare can be overwhelming, but here, our patients don't have to figure it out alone. I walk them through their coverage and make sure they're getting the most of their benefits. It's the kind of support most people don't expect, but always appreciate.
At Oak Street Health, we care for each patient as a team, each of us bringing our own perspective. Because we're all getting to know the patient in our own way, we see the full picture. That's how every patient gets more thoughtful care. And for many, it makes all the difference.
I was impressed the first time I came in because they really listen to you. Here, they spend the time with you. I should thank them very much because I wouldn't be sitting here if it wasn't for them.
So join us at Oak Street Health. As part of CVS Health, you'll be joining a larger community that's committed to helping people live healthier lives. Explore careers at jobs.cvshealth.com.